The Need to Know.
I am your co-host. Good morning.
Danielle Ferguson.
Kenya Harris.
And Shaquille Lockhart.
Okay, you guys, health disparities are seen on the U.S. What are your thoughts on this? Well, first, health disparities are very close linked to social, economic, and environmental disadvantages. For all Americans, other influences on health include the availability of and access to things such as high quality education, nutritious foods, clean water and non polluted air, culturally sensitive health healthcare providers, and healthcare insurance. Recommendations to eliminate healthcare disparities include ensuring a strategic focus on communities at greater risk, increase the capacity of prevention workforces, as well as support the research used to identify effective strategies to cease health disparities. Okay, like what are some other areas that help decrease health disparities?
Well, we have the Affordable Care Act in place, and that has helped a lot. It's been placed in 2010 to increase the focus on healthcare's costs and accessibility. Healthcare costs have been on the rise for decades and continues to grow. People that are privately insured and have to pay little to no out of the pocket for care are overusing the system. Since there is not much regulation on the market, care is driven by need as opposed to demand. As far as health disparities in the African American community, we have people who have diabetes. Um, they're not able to go see the doctor or able to afford the type of medication that they need in order to stay alive or stay healthy. And healthcare is not necessarily provided when a person becomes sick um, or loses health, but is progressive and always should be provided as a preventative measure. So the ACA is very important to have because it is very important that we have health insurance.
And I just want to add to your cost access and quality. I know like it's like the main term. That's what healthcare is based on. But like what if people like say in African American communities, they have issues like with mental health as well. Like we don't go seeking that because it's part of in the culture. Like it's seen as a taboo to have a mental health issue. Like, if you do, then like oh something's wrong with you. Like something's like wrong with your whole family. Like you don't want to be outcast or ostracized. Like what are some other issues that an African American race or like any other race like faces?
Um, One big thing that's uh, playing a huge factor in our world today is HIV and AIDS. Some statistics show that in 2014, the Black community was among the highest with 11,201. Those who are infected for the white 9,008, and for like Hispanic and Latinos 7,552. And one thing I found tremendously, this company was the rate among black women. 2014, they had the highest rate amongst females, which was 4,654. A lot of skepticism about HIV and AIDS nowadays is who's at risk of it. And from everyone's perspective, it should be it's everyone, even those who, even like infants. You take infants who aren't even born yet. If their parents have it, it's like they're pretty much bound to have. There's a high percentage chance that they could be born with it as well. So just taking that into consideration, like everyone is at risk of it. The only way to prevent one of these types of, well, this type of illness is abstinence. And another question that people ask now about HIV and AIDS is how long can people live with it? And with AIDS, there's no treatment for it, so like the highest expectancy rate of living for like without treatment is about 3 years. And but as far as the illness itself, going treated, you can last like a long time, pretty long time. And yeah, I mean, HIV and AIDS is a very big epidemic nowadays. So
And I think when we think about HIV and AIDS in the African American community, we think about how people are finding out later because they don't have any access to going back to the Iron Triangle, the cost, access, and quality. They don't have any access to get to the hospitals, get to the clinics, get to the doctors, get to the pharmacy, or anything like that. When we talk about access, it's predicted by race, income, and occupation, which ties to health disparities. It is society's duty to ensure equitable access, security of resources, limited access to the poor and those who live in rural areas. When it comes to health matters, everyone becomes attentive. People believe that with good health, one can virtually accomplish anything that they desire.
Okay. Well, you guys, I got like one more question for you guys. I'm not sure it's more directed towards the women. Well, I guess towards you too, Kelly. If you were married, not away. Okay. So there's a company called Hobby Lobby. It's a craft store. They're based on their beliefs, like they're Christians. They believe that they do not have to provide contraceptives to their employees because in Christianity, like you're supposed to wait till you get married to have kids. Do you think that this is the right way to go about things? Like, do you think like they have like the right to do this?
But it's like you can't tell people what to do with their lives or anything like that. So, and we have this amendments that we follow. So we're free to do whatever we choose. And I feel like as a woman, we do whatever we want to do with our body. I don't think anyone else should have a say so whether or not what we want to do.
I feel like the company, they definitely do have the right, to have it as a policy, but just make sure that it should be aware to, their employees that, okay, this will not be awarded to you, this will not be included in the insurance plan, and it'll be up to the employer to decide whether they want to continue working there
I'm just piggybacking on what Danielle said. When she said we all have our own, we can make our own decisions. Euthanasia in adults and as well as children is another big thing. Um, People ask like nowadays, do we have the right to die? Um, I feel like that's a moral claim, and pretty much claim like death pretty much claims us at the end of the day. Um, People ask what is euthanasia, and they like to put it in words to make everyone feel comfortable with it. They call it good death. Um, and it's pretty much just something that's intended to cause death amongst those who just can't really bear the thought of like living with the suffrage. Um, they call it assisted suicide as well. This is when one assists another and taking his or her own life. An example of that would be like a physician pretty much providing deadly drugs to the patient who so-called just can't bear the suffrage anymore. A lot of people ask, shouldn't a person be able to say his or her pain is too much and want to be freed of suffering? It's pretty much impossible to live without suffering. It makes no sense to talk about a right to be completely free of it. People die expectantly every day, from either natural causes or accidental causes. And to me, this philosophy is just absurd. Um, However, if one considers the so-called right to choose death, when suffering is too great, then we can question what kind of what kind of suffering
there.
qualifies as thing.
I'm glad that you brought that up. How do you think parents should go about making a decision for their children when it comes to that?
Um, I feel as if the child, regardless of how old the child is, I feel like the adult, the parent has the right to make that decision for him or her, simply because of the fact that I don't feel like the child is mentally, you know, they're completely, they haven't, exactly experienced enough to know exactly what suffering is. They could just be saying that just to get attention. So I feel like a parent knows exactly. I feel like a parent knows the child more than the child might know itself.
You don't feel like the parents will have like a kind of a biased way of approaching it though, because that is their child, so they're gonna wanna like provide the best for the child, make the best decision, and it may not be the one. It may not be the best decision for the child. I mean, they'll feel like it is, but it won't necessarily be the best for the child.
Um, in that case, probably more than likely, I think every parent wants to be what's best for their child. Like I said, you never know what a child is actually feeling. Like a child uh, pretty much loves the comfort of their parent. So he can do that. Him or her can do that. Just to get that love or get that attention, full attention from their parent. But yeah, in that case, a parent might make a wise decision.
I think I can go with like other cases too. Like it was a man and their wife. Like with this Terry Jones case. Like the wife was pregnant. The husband was like he had the rights, but the parents are the ones who like, oh, this is our daughter. We need to do this.
Right.
It's like those type of things with like different ethics are involved. Like it's hard to make those kind of decisions really when it's not like your own body. You can't voice that for yourself. It's like a touchy subject.
Yeah. Definitely.
Well, that's all for our health disparities in project.
Thank you.
Thank you for joining.
And again, I am Jaquel Lockhart.
Danielle Ferguson.
Yeah.